Okay, so I see my patients at a 2-week follow-up appointment, and at this point, this is when they can start cleaning under there. So this is when I give them a water pick. So I give them a little water pick that's got, so basically a water reservoir and a little power hose, and I actually unbox it in front of them, and they'll go ahead and start to use it right there in the chair. So that way I can guide them, I can kind of show them how to use it. So I tell them to go up to a mirror, and they're going to go ahead and like pull their lip back with one hand, and with the other hand they're going to spray along the entire prosthesis. So by doing that in front of a mirror, it kind of gives them a good idea of where to put their hands, because everything's still new to them at this point. And 9 times out of 10 they'll squirt it and get water all over the mirror and just everywhere. So it's kind of a learning curve to use the water pick. I make sure to have them use it at the lowest setting. So the water picks usually come to like setting like 1 to 10 or something. I put it on the lowest one, so like 1. And they just got to try it out a couple times before they use it. But I find that water picks are a really good way for people to keep their all-on-4s clean. If they're pretty compliant and they have pretty good manual dexterity, I like to give them some Superfloss. So Superfloss is the floss with like the stiff end, and then it gets like kind of fuzzy and wider at the end of it. So they can actually like thread it through on one side and pluck it out on the other side of their prosthesis and just floss it just like they would a bridge. So I go over hygiene pretty thoroughly at this appointment. I recheck occlusion at this point, and I just kind of assess their overall healing, like if all the swelling's gone down, any bruising if that's gone away, and just kind of like how they're feeling. And I also pump them up to keep them motivated to stay compliant and look forward to the final set. That's pretty much all I do at this 2-week appointment.